Welcome to our presentation on emerging once-weekly therapies for type 2 diabetes mellitus, emphasizing on the aspect of controlling glycemic variability in type 2 diabetes mellitus, with a focus on Trelagliptin. Let's understand this innovative treatment and its role in current therapeutic landscape. Let's explore the various once-weekly therapies available for diabetes management. These include DPP-4 inhibitors like Trelagliptin, GLP-1 receptor agonists like semaglutide, and once-weekly insulin options like icodec. Trelagliptin is a uniquely engineered, once-weekly oral DPP-4 inhibitor. Its molecular structure and properties aim to improve pharmacokinetic profiles, allowing for less frequent dosing. Trelagliptin demonstrates potent inhibition of the DPP-4 enzyme, with the lowest IC50 value among its peers. It maintains effective plasma concentration over a week, reaching steady state by week 12. Trelagliptin exhibits slower dissociation from the DPP-4 enzyme compared to other inhibitors, supporting a longer duration of action and enhanced therapeutic effect. The pharmacokinetics of Trelagliptin reveal an 85% bioavailability, a half-life of 54.3 hours, and significant protein binding. It is metabolized via cytochrome P450 and excreted through the kidneys. Trelagliptin boasts the longest elimination half-life of 54.3 hours among DPP-4 inhibitors, allowing for once-weekly dosing and consistent therapeutic levels. Trelagliptin is approved for the treatment of type 2 diabetes mellitus. The recommended dose for adults is 100 milligrams orally once a week, with adjustments based on renal function. While Trelagliptin is generally safe, it is important to be aware of serious adverse reactions such as hypoglycemia, pemphigoid, acute pancreatitis, and bowel obstruction. Special populations, including those with impaired hepatic function, pregnant women, and lactating women, require specific considerations when administering Trelagliptin. Trelagliptin should not be administered to patients with severe ketosis, diabetic coma, type 1 diabetes, severe infections, or those undergoing surgery and serious trauma. Be mindful of drug-drug interactions when prescribing Trelagliptin. Certain drugs can enhance or attenuate its hypoglycemic effect, requiring careful management. Clinical trial data on Trelagliptin spans various phases, involving around 3,000 patients. These studies provide evidence on its safety, efficacy, and clinical outcomes in type 2 diabetes mellitus. Phase 1 studies show that Trelagliptin 100 mg tablets are bioequivalent to Zafatec tablets under fasting conditions, demonstrating similar pharmacokinetic profiles. In Phase 2 studies, Trelagliptin showed the highest HbA1c reduction with a 100 mg dose. This dose effectively inhibits DPP-4 activity, translating to improved glycemic control. The Phase 3 study in India involved 240 adults with type 2 diabetes mellitus. Trelagliptin administered once weekly showed comparable efficacy to twice-daily vitagliptin, with no significant adverse events. Further Phase 3 data revealed that Trelagliptin achieved target HbA1c levels in 54.87% of patients, demonstrating similar safety and efficacy to vitagliptin. A Japanese study compared once-weekly Trelagliptin to daily allagliptin, showing similar efficacy and safety in managing type 2 diabetes mellitus. Phase 3 trials indicated that Trelagliptin is non-inferior to allagliptin and offers a convenient dosing option for T2DM management, with comparable adverse event rates. Long-term studies confirm the safety and efficacy of Trelagliptin as monotherapy, or in combination with other anti-diabetic drugs, providing a reliable treatment option for T2DM. Trelagliptin has demonstrated long-term safety and efficacy in patients with type 2 diabetes mellitus, T2DM, when used as a monotherapy or in combination. Over a 52-week duration, patients showed significant improvements in HbA1c levels, response rates, and plasma glucose levels. The DPP-4 inhibition rate was maintained at 78 to 80%, ensuring well-tolerated long-term safety and efficacy. A clinical trial investigated the efficacy and safety of Trelagliptin in Japanese patients with type 2 diabetes who have severe renal impairment or end-stage renal disease. This randomized Phase 3 study aimed to provide insights into how Trelagliptin can be used effectively in this specific patient population. In a Phase 3 randomized multicenter trial, Trelagliptin was shown to be effective in patients with type 2 diabetes mellitus and severe renal impairment. Over a 52-week period, patients experienced significant reductions in HbA1c levels and maintained safety with no severe hypoglycemia. This study highlights Trelagliptin's potential for managing diabetes in patients with renal challenges. A real-world retrospective cohort study examined the glycemic control of once-weekly and other administration frequencies for DPP-4 inhibitors in patients with type 2 diabetes. The study included data from Japanese medical records and aimed to understand the practical implications of different dosing regimens. The study found that once-weekly Trelagliptin achieved greater target HbA1c levels, less than 7%, compared to once-daily or twice-daily regimens. With a patient base of 7,229, the results showed that 79.1% of patients on once-weekly Trelagliptin reached their HbA1c goals, demonstrating its effectiveness in real-world settings. A Phase 4 study explored the efficacy and safety of Trelagliptin in combination with insulin therapy in Japanese patients with type 2 diabetes. Over a 52-week period, the combination therapy significantly reduced HbA1c levels without increasing the risk of hypoglycemia, making it a promising option for managing diabetes. The long-term Phase 4 study demonstrated that combining Trelagliptin with insulin therapy effectively reduces HbA1c levels in patients with type 2 diabetes mellitus. The combination therapy showed a decrease in HbA1c by 0.56% and 0.37% in different groups, with no severe hypoglycemia, highlighting its safety and efficacy. A randomized pilot study investigated the effects of Trelagliptin and allogliptin on glycemic variability in patients with type 2 diabetes. The study aimed to understand how these medications influence blood glucose fluctuations and overall glycemic control. The exploratory trial showed that Trelagliptin effectively reduces glycemic variability and improves glycemic control without causing hypoglycemia. Over a 29-day period, patients experienced significant reductions in blood glucose swings, which can help lower the risk of cardiovascular complications. A meta-analysis of 6 randomized controlled trials confirmed the safety and efficacy of once-weekly Trelagliptin in patients with type 2 diabetes. The analysis showed that Trelagliptin provides good glycemic control and is well tolerated, making it a reliable option for diabetes management. A randomized controlled study examined the effects of Trelagliptin on beta cell function in patients with type 2 diabetes. Over a 24-week period, Trelagliptin maintained the disposition index, indicating improved beta cell function and significant increases in HOM 2%B levels, showcasing its potential benefits for diabetes treatment. A study compared the quality of life and treatment satisfaction between once-weekly Trelagliptin and daily DPP-4 inhibitors in T2DM patients. The results showed that Trelagliptin significantly improved patient satisfaction and quality of life, making it a preferred choice for diabetes management. A study on switching from daily DPP-4 inhibitors to weekly Trelagliptin in type 2 diabetes mellitus patients revealed significant improvements in HbA1c levels, body weight, and treatment satisfaction. The switch was well tolerated and provided better diabetes management outcomes, highlighting the benefits of weekly dosing. Switching from daily DPP-4 inhibitors to weekly Trelagliptin improved treatment satisfaction and diabetes management outcomes in type 2 diabetes mellitus patients. Over a 3-month period, patients experienced better glycemic control and body weight management, making weekly Trelagliptin a favorable option. Trelagliptin offers several advantages and unique features, including once-weekly administration, high selectivity, easy switchover, low risk of hypoglycemia, potent DPP-4 inhibition, and improved quality of life. These benefits make Trelagliptin a valuable option for managing type 2 diabetes. Beyond its primary advantages, Trelagliptin also provides minimal self-monitoring, reduces glycemic variability, achieves higher target HbA1c levels, offers potential cardiovascular protection, improves beta cell function, and ensures long-term safety. These features further enhance its value in diabetes management. Thank you for taking the time to learn about the benefits and efficacy of once-weekly oral DPP-4 inhibitor, Trelagliptin. We hope this information helps you understand its potential in managing type 2 diabetes effectively.